All right. Hello. It's Amina Goodwin Fernandez, the infectious doctor, and I am sorry for the delay for those of you who were waiting. In medicine, there's never you can't plan it when you're practicing, especially in the hospital. You never know what is going to come your way, and so you can have light days, and then suddenly one afternoon it gets really busy again. So sorry for the delay. Anyway, I just wanted to come on and give another update of my thoughts. I know some of you look forward to this, and I appreciate you spending the time to listen. And thanks for sharing with your friends, and also thanks for suggesting or giving questions. And some people give me questions in person as well. So let me try to get straight to it and not take too much time. The first thing, to wear or not to wear a mask. So I remember, I think the first time I started talking about this coronavirus thing about maybe 3 weeks ago or so. Back then, I specifically said that based on CDC recommendations, a mask was not recommended. They back then spoke about the fact that wearing a mask, well, first of all, the surgical masks, they said, were only good for 20 minutes. And the longer you keep them on, there's moisture and that can promote multiplication of viruses and other germs. So they were recommending against masks. And the big thing at that time as well was the fact that there was a critical shortage of masks. And excuse me, they wanted to essentially make sure that there was not going to be a situation where healthcare providers taking care of patients would not have a mask to use. Of course, the healthcare environment is the most high risk situation. Now, since all that, like all of us know, this coronavirus issue is changing rapidly, several times per day. And I don't know, nothing is set in stone. None of us can pretend that, oh, what we say, this is it, and so on, because anyway, there's data that comes out every multiple times a day that lets us realize that certain things, okay, we need to change course, etc. So lately, this week, actually yesterday, well, and by the way, the CDC has not specifically given an advice. I don't think, at least not up until this morning, they didn't say specifically everyone should wear a mask, but more and more people are wearing masks. And one report I read yesterday from the MMWR, that's a report put up by CDC regularly. They looked at people in Singapore and transmission, and really what that report revealed, that transmission happens. We knew it, but anyway, transmission happens from people without symptoms from 1 to 3 days before. So from 1 to 3 days before they have symptoms of a cold or something going on, COVID, they actually have infectious virus in their airways, and they can spread to others. And so for that group of people in Singapore whose infections they studied, they realized that about 12% of those infections were basically caught from people who did not have any symptoms. So they report that as pre-symptomatic transmission. And by the way, I'll be looking from screen to screen because I actually have my YouTube channel on as well, just to have it out there. There's so much misinformation out there about COVID, by the way. So if I can give some information that's pretty reliable, then I would do that. So anyway, so pre-symptomatic transmission accounted for about 12 or so percent of those infections in Singapore. And so, 12% is a pretty big number. Now, there was another report that came out recently that was more in the news media, but they spoke about a choir group in Washington where 60 members of the choir, this was on March 10th, of the 60 members of the choir, 40 of them got COVID-19. Imagine that. And at the time of choir practice, nobody had any symptoms of any kind of infection. And so they concluded that this infection happened from a person before they had symptoms. And 40 of 60. That's a dramatic number. And so with this information coming out now, I'm inclined to advise people, if they're going out, to wear a mask, right? Now, of course, most of us should really be staying put. In many areas, there's a lockdown. There's a lockdown in my area, in my county, Mississippi, and many areas on the lockdown as well. Essentially, no unessential travel or mixing with people. So the best thing, of course, stay put, just stay in your household, stay among your family, and only if you have to go somewhere, the supermarket, the pharmacy, and for those people who are in essential services who need to work, then going out mixing with people, then you put on your mask, right? Going to the supermarket, etc. Of course, if you're not close to people, like within 6 feet of people, that's advisable as well, because the closer you are with somebody, then the more likely you are to come in contact with their secretions, etc. And the big thing, of course, is that sustained close contacts. That's why healthcare workers and then family members in a household of somebody who is infected would be much, much more likely to get infection than just kind of passing somebody transiently in the store. So wearing a mask, I think it makes sense, especially if you're going to be out for a while, if you're for whatever reason going to be in a store, maybe some people at work, etc. Of course, us in the healthcare environment, many hospitals now are just saying to staff members, just keep on a mask while you're at work. And for us, of course, if we're pre-symptomatic, so we have no symptoms yet, but the infection is brewing in our system, then theoretically, if we go to our patients and so on, we could potentially spread. And then also, if we have a patient who comes in for some other random thing, and then the infection is brewing or developing in them, then they could potentially also spread it to us. So the CDC hasn't made a call on this yet, but I have a feeling that they might just make that call that people, and of course it will be optional, but people should consider wearing a mask when going out and being with other persons. The transmission, they talk about it being from speech or from other vocal activities like singing. And the louder the voice, the more likely there is to be transmission of the virus. So I thought that was pretty interesting, especially with this choir, 40 of 60. Now, people are getting concerned as well about aerosols as opposed to droplets. And droplets, of course, are those heavier particles, like when you talk and you can kind of see things coming out, and those can go up to about 6 feet. But then the aerosols are the finer particles that can be in the air and travel for many, many feet. Now, of course, the further you are from the person, it's going to get diluted. And so you're not going to have like a heavy concentration of aerosols in the air to breathe in and cause infection. So even though people are concerned, like, oh no, they're saying it's in the air, it's in the air, we can breathe it in. But if it's such a low concentration, then I think there's no need to really panic about that risk that you're going into the supermarket and it's in the air of the supermarket, you're going to catch it. It's just too like low concentration. Furthermore, most likely there's proper circulation from the ventilation system, etc. And so it's just not that likely. But again, an extra layer of protection with a mask, of course, probably does not hurt, and that's what we're seeing now. And hopefully, the mask production, well, it's already ramping up. It's still not ideal, but mask availability should get better. The surgical mask generally that would be better. And then also when you wear a mask, you need to put it on properly. It has to be over your nose and your mouth. It's kind of annoying. I see people wearing masks and not infrequently it's just over the mouth, it's not over the nose, and or some people might have it on the chin. Now, of course, there's no protection if it's not over your mouth and your nose. You're probably going to catch most of the virus from breathing it in anyway, and then, well, if your mouth is open, yeah, but mostly from breathing it in. So if you're not covering your nose, then there's no protection at all from the mask. And then, of course, you don't want to be fiddling with the mask as well. um yeah. I was just looking at this comment about distance, but you can still smell perfume, yeah, because the aerosols really travel far. But yeah, the farther away, the more dilute it is. So I think wearing a mask, I used to tell people before, oh no, I don't think the mask, even like I was telling my husband, you're probably not going to benefit that much from a mask. It's an added layer of protection, and it's probably not a bad idea. But ultimately, if you stay put, stay at home for the most part, and then if you go out, just really try to stay far from people, try to be in more ventilated areas than not. And then if you put on a mask, make sure you put it over your mouth and your nose. Okay, so that's our first question. To wear or not to wear a mask? I think the answer is yes. Second, what to do if you're exposed to COVID-19? So, a lot of people obviously worry about that. Oh my, whatever. So exposure, I think it depends on the how significant it was. Now, if it was somebody in your household, because we know COVID um, is very, very, the virus is very contagious. Coronavirus is very contagious. So if somebody in your household has coronavirus disease, very, very likely you're going to get it as well. And so that type of exposure would be high risk. It's probably sustained close contact because you're all in the same house together. And so if you're exposed like that, you're probably, it would be best if you basically self-isolated for 14 days. 14 days because generally speaking, it takes up to 14 days to manifest symptoms of infection if you're going to get infection. So high risk exposures, meaning you didn't realize they had COVID and you weren't wearing a mask and they were not wearing a mask. So you're probably going to get it, or high likelihood of getting it. And so you self isolate, let whoever, I guess your work, whatever, know that, hey, you somebody that works in your cubicle or somebody that lives in your house or somebody who you were with, hanging around with for probably, half an hour or longer, just got diagnosed within 14 days of you being with them, right? And so you isolate for 14 days observing for symptoms, and you're going to observe for fever, for cough, shortness of breath, and there are multiple other symptoms apparently that people can get, maybe not as likely: diarrhea, vomiting, body aches, joint pains, etc. Most common, of course, is the fever and the dry cough, and then probably shortness of breath. So you watch for those symptoms during that 14-day period. And the moment you have a symptom, if you're concerned, well, most people, like we say, are going to have mild illness. So you can probably continue to monitor yourself with the symptoms if they are mild. If you develop difficulty breathing, or you feel sick, you feel like you're going to pass out, or just anything very concerning, obviously you need to call your doctor, right? If you're an older person, if you have medical problems, obviously you probably should call your healthcare provider and let them know this is what's going on, and they will determine whether or not you need a test for COVID-19. Okay, but when you have a significant exposure, someone who's proven to have COVID-19, because we know it's super infectious, the best thing for you to do for the other people around you, for your loved ones and your workmates, etc., is to isolate yourself. Depending on the type of job people have, their work might tell them you can come and be observed at work, but definitely keep on a mask. If you're at home isolating, if you have to go to your family, you have to go into the kitchen or whatever to get food, put on a mask. Every time you have to leave your space at work, leave your own space in the house, put on a mask. If you're going next to anybody, if you go to the bathroom, if you're going to any of the other common areas, put on a mask so that if you cough or sneeze or, I don't know, talk too loudly and you have secretions coming out with the virus, then it will be contained in the mask. And you basically do that for the whole 14-day period. Of course, let the people around you know, I think, coronavirus, I might have it, I was exposed to somebody, so that they too know that they need to stay away from you at least 6 feet and take precautions, clean surfaces, etc. And then if you get it, of course, you contact your healthcare provider, or if you think, you might have it, or if there's any concern medically based on your situation, call your healthcare provider. Don't listen to me, just call your healthcare provider, okay? Now, just yesterday, a nurse, somebody asked me about drinking hot liquids, if that prevents COVID, just yesterday. And then my husband mentioned to me that people are talking about this, about the fact that, if you drink hot beverages, then that would prevent it, because the virus doesn't like heat. And if you're swallowing the hot beverages, then that's going to kill it, right? Now, the only thing you have to remember is that coronavirus doesn't just live in the throat, or we call it the pharynx, the back of the throat. It's in the nasal passage as well. So it's in the nasopharynx. And so when you're drinking your hot beverages, it's not up in the nostrils. And so, and furthermore, the virus multiplies more in the nasopharynx, right, than back of the throat, because when they do swabs in the beginning, they were doing swabs, both nasal swabs and throat swabs, and the nasal swabs were more likely to be positive than the throat swabs. So there's a lot of multiplication of virus in the nostrils. And also, when you catch the infection, you're more likely to catch it from breathing in the infected air or secretions, as opposed to like your mouth, or like we touch on mouth and so on. So anyway, nose, mouth, both, right? But certainly there's more high replication in the nasal passages and the throat. So drinking hot liquids is not going to help that. And certainly drinking hot liquids, hot teas and so on, it's soothing and it makes you feel good, and that might alleviate some of your stress. And also drinking hot liquids like hot teas, green tea, herbal teas, and so on, that's obviously going to be more beneficial to your body and your overall health than drinking a soda, for example, or some other thing that has no benefit to your body. Okay. Why is it imperative now more than ever to optimize your health? Well, right now, because of the situation with the healthcare system, people the strain, especially well in some areas more than us. Obviously, New York is just completely overrun with COVID-19 and other areas, but New York seems to be like the biggest hotspot. New Orleans is pretty bad as well. So essentially, you when our healthcare system is overrun with like a pandemic situation, you really don't want to be in a situation where you have to be trying to seek healthcare, if you don't have to. And a lot of the healthcare problems are actually preventable. So the chronic diseases that a vast amount of the population would be having, high blood pressure, diabetes, and those things, the lifestyle diseases, they can actually be pretty well controlled with medications that your doctor prescribe, and even more importantly, with diet and lifestyle modifications. And so you want to make sure that you are doing what you're supposed to be doing for over all the years. You want to do that more than ever now because you don't want to be stuck in a situation where you have to go to the emergency room. If you have to go, you have to go. But if you can prevent going, you don't want to go because then who has coronavirus around there? It's a healthcare environment. And there are other things as well that you can catch from hospitals. So you don't want to put yourself at risk for catching anything else and having to deal with something else, right? Also, healthcare providers now it's stressful for all of us. We try to do the stress as much as we can, but you want to go to the doctor when the doctor is least stressed, or the nurse practitioner, right? That's why I always used to go for my appointments early in the morning because you want to catch whoever your healthcare provider is nice and fresh. But with this whole situation, as much as we all try to deal with our stress, you it's high stress. And even I get a little stressed sometimes, but I go back to my whole thing about doing my best, but it's high stress. And so if you don't have to, if you can control yourself so you don't have to be going to the doctor so often, then you want to do that. You don't want to have to go to stressed healthcare providers, right? And then, of course, if you don't take care of your health and your diabetes gets out of control and, your body's all inflamed because of all your high blood sugars and then your pressure's high and you can get a stroke and so on. And then if anything, your body runs down over time, then you're going to be more prone to a serious case of COVID if you do catch it, right? This COVID-19, I mean, as much as we would all like it to go away, next week or next month, it's probably going to be with us for a while. It's probably going to be with us probably forever. But, hopefully we'll get a vaccine at some point. But like somebody on YouTube here is saying, why can't we just have why can't we just have a vaccine? Um, well, if you can develop vaccines, I'm sure it's easy to develop vaccines, but you have to test them on people. You have to make sure that they are safe. Who wants to take a vaccine that was not proven to be safe, proven to have long-term consequences or adverse effects? Not me. If they rush a vaccine out, I won't be first in line to take it if I knew or if I felt like they didn't study it long enough to make sure it was totally safe. Okay? This person saying, read all the text. Why can't we just use a live vaccine through the rectal delivery? Well, I don't know. I don't know of any vaccines that are given that way. And as I said, the scientists are probably doing whatever they need to do scientifically to come up with the safest vaccine. They'll have to test it and study it and make sure it's completely safe. Now, so that's that. So COVID is going to be with us for a while, and so we have to take care of all the other aspects of our health because we have maybe a year or longer before we have this thing on control. Okay. And then also at the end of all this, I mean, who knows? I kind of predict, I'm not trying to be pessimistic, but I think with how stressful this has been and will continue to be for healthcare providers, probably a lot of us, maybe not me, but a lot of healthcare providers might take long sabbaticals after this all quietens down. Might have to just kind of take a break to kind of rest up and recuperate, etc. Or some people, I mean, I wouldn't be surprised if some people just kind of switch careers, But maybe that won't be the case. I know there is already a doctor nurse shortage in many parts of the world, in the United States and in many other countries as well. So imagine if the shortage gets acutely worse by the time this is over. So you don't want to, you don't want to have to be depending on people too much for your health and well-being. You want to do whatever you can to keep yourself healthy, right? Then the last point I was going to touch on was why this won't be the last outbreak. A lot of people are talking about how this was a manufactured virus and, it's bioterrorism, et cetera, et cetera. I mean, I'm not going to say I know everything. I wasn't there in China, right? But I do know that we have infections. We have zoonotic infections that transfer from animals to humans, right? And that's been the case forever, and we will continue to have that situation in the future where you have transfer of germs, whether viruses or bacteria, from animal hosts to human. You don't know how it happens, but it's just when everything um, kind of coincides in the perfect kind of storm, the virus mutates somehow. The human being happened to be there, it got into the human being who just happened to be perfectly susceptible, and then it multiplied and then was able to spread to other people and spread like that. So this is not this happens, and it probably will continue to happen, especially because now with population is growing, people are encroaching on animal spaces like clearing forests and everything. So we are kind of encroaching, spreading out and getting closer to the forest where the animals are. And so theoretically, with that closer contact, we can have spread like that. Of course, now travel outside of those areas. So if you had an outbreak of some infection in that tribe or community in any of these areas, it would just kind of die out in that community because they weren't traveling anywhere anyway. But now we have such rampant mixing of people, people from villages coming into town, more urbanization. And then it's so easy to get on a plane. And some of these communities, people are more financially well off. So there's just easy travel. And so with easy travel, it's going to be much easier for these things to spread compared to decades ago. And then they talk about climate change as well, and just different climate patterns, more rain, more mosquitoes. A few years ago, we dealt with the Zika virus situation, which was quite scary. So there's always going to be something. There was SARS 20 years ago. There was MERS about 10 years ago. We're dealing with this one now, SARS 2, and there's always going to be something. So just be prepared for it. Man-made, maybe sometimes, I don't know, but there's always going to be something that's not man-made, that's just spread from animal host to human host. And so you just want to really optimize your health, like I say, so that you can be the strongest possible host to fight whatever infection. So I tried to keep it pretty short today. And somebody originally, but going in the sea is not going to hurt you. I mean, you're going to be swimming and exercising, and all that is going to be good for your body. But I wouldn't necessarily say that going in the sea is specifically preventative for COVID-19. Of course, you want to keep a distance when you go to the beach. Apparently, people have beach parties and so on up until recently in Antigua. And so you don't want to be congregating. You just don't want to congregate. You have to stay far away. And again, yes, there's lockdowns, and yes, that's going to impact the economy. But if you have everybody coming down with COVID-19 at the same time, then acutely or severely infected people at the same time. And so that is why the social distancing, 6 feet at least, if you have to go out, but for the most part, stay at home. So thanks for your comment, Bev Brown, and thank you for your good wishes. And let me see who else. Okay, so I guess if there are no other questions, I would just recommend for everybody. Somebody said, okay, since the virus attacks the lungs or the intestine and doesn't move by blood and keep at site attacking epithelial cells, causing infection. Yeah, so I guess that's why they were talking about rectal vaccine. I'm not a vaccine expert. I'm not a virologist. So I don't know, even though they have found the virus in stool samples, it's not been proven that the stool is one of the modes of transmission of infection. You would think, usually virus is transmitted by stool, like hepatitis A and so on. And bacteria like typhoid. We call it fecal oral spread. So if water or foods get contaminated with feces, and then you eat that contaminated food or drink that contaminated food, and then that type of infection infects the intestinal tract and manifests like that. But coronavirus is actually a respiratory tract infection. It infects the airways, the nasopharynx, the oropharynx, and that is why it's from breathing in and touching the mouth and maybe the eyes and so on, why you get this infection, but not by, it's not a mouth, it's not where you eat or ingest things for the most part. So for that reason, like talking about that rectal vaccine, that is why I would imagine that a rectal vaccine is not going to help, because the virus inoculates in the nasopharynx, the nasal passages, or the back of the throat. It doesn't inoculate in the gut, in the intestines. All right, well, y'all, thank you for watching, and stay safe. Don't go out unless you absolutely need to. If you do go out, probably better off putting on a mask if you're going to be around people a lot. If you feel like you're going to have sustained close contact with people who could potentially be infected, they can transmit infection for 1 to 3 days before they get symptoms. Most people will get symptoms, but there are people who will never get symptoms. That's been proven as well. And take care of all your medical conditions. Now, a lot of people, people working from home, they're at home, and people are probably more relaxed. It's kind of like a vacation. So you might think, I'm not going to exercise. Oh, I'll wait until this is over to exercise. Or, you want comfort food because, we're feeling sorry for ourselves. So I'm going to eat more cupcakes or more donuts or whatever. But this is the time to, hunker down, get aggressive with everything, because, when it's over, what are you going to do? Try to lose all that weight or try to get your sugar under control, et cetera, et cetera. So as much as we all want to have more comfort food and just kind of relax and not wake up early to do our exercise and so on, we have more time than ever now, so we probably should do it. So take care, everyone, and I am out. Bye-bye.